and go up to the spinal area above the sacrum, the L region, then on to the left side of the spine. Do a gentle stretching through the spine. This could be repeated a few times because these are where the neural messages go into the entire body. As we loosen the multifidi muscles, or multifidi, some people say. At this time, we're going to be working with the cranial, the C spiny processes, and into the skull through the occipital area. After we finish coming through the C area into the occipital area, we take a gentle walk through the center of the cranial area. Have the patient come up to the left side here. We come right down the center through the forehead to the tip of the nose and into the temporal area. Gently into the area right in front of the ear. And all these areas are gently relaxed. These can be repeated again. And the final walk is from the radial nerve area in the back of the shoulder on a 45-degree angle back to the multifidi muscles. So we'll do a gentle stretch on this 45-degree angle. And this completes the acupressure walk. And any one of these can be repeated. It's very gentle, there's no threshold. The patient is relaxing down very, very quickly. It's a very gentle treatment, no drugs on this 45-degree angle. And now we'll move on to the final resolution of the fibromyalgia by working with what we call the oxygen receptors. There are about 100 points on the body. We'll have a chart that we'll follow with the twin head massager. We're ready to start with this now. Ladies and gentlemen, we're ready to start the vibration therapy portion of the protocol. And the first thing we do is to take some warm towels and cover the patient with them. You could put these in a dryer, and as they come out of the dryer, keep them warm and place them. You start at the neck area, let the towel run out. The second towel, start at about the sacrum, or the T section of the body, let that run out. And the last one, start at about the hamstrings or the base of the glutes. Tuck the feet under the towel. Okay? If the atmosphere is a little cooler where you're working, you might want to put another blanket over this to trap the heat that's in these towels. But this warmth now starts to stretch out the muscles and relax the patient very thoroughly. As you can see from the chart, there are about 100 spots, and we will start with the points at the base of the neck. And what we do is we gently tap through these areas. Along the spine, into the glutes, at the fold of the glutes, inside the hamstrings, at the tip of the tibia, into the soleus, and the base of the calf. We can also do the base of the foot at this point in time with both heads. Now this only takes a few minutes, as you see, as we walk down, so it can be repeated. I usually work with the patient for about 15 or 20 minutes. We have a digital clock here, and as the time goes by, the relaxation is very, very profound. The patient's possibly falling asleep. You can ask them if there's any painful points along the meridian as we go through here, and these points. We can also get a touch of the hip at this point in time. Now I'm keeping this on here. It's a tapping motion as we move along for about 10 to 15 seconds per point. Time is not the factor here, it's the repetition. As the vibration hits the oxygen receptors and starts opening up the transition points in the protocol, and I'd like to read that again quickly at this point in time from Dr. Turchaninov's textbook on fibromyalgia. This is very important because this is the crux of this therapy. Again, if trigger points are usually located in the muscle bellies, tender points are mostly positioned in the place of transition of the muscle into the tendon or insertion of the muscle into the fascia or bone. Extremely important, ladies and gentlemen. This is the answer to hypoxia, hypoxemia, fibromyalgia, many pain syndromes. We'll work with these points. You can see how quickly it can be done now that the initial phase is over. We can go down with these points. It's almost like paint by numbers. And ladies and gentlemen, we've now turned the patient over, and we'll repeat the vibration therapy on this side of the body with the points on the chart. Again, we start with the towels. They come out of the dryer, they're nice and warm. We cover the patient from the neck, let the towel run out. Start at about the abdominal area, or just above the abdominal area, on the solar plexus, on down, let that run out. And the third towel at about the knee area, quadricep area, tuck it in. Okay. Again, you can put another blanket, light blanket over this if you'd like to trap this heat. Now the vibration therapy now begins. We start, as we turn on the vibration, I usually start the first-time patient on the low setting of the vibration unit, or the one that you may have on the low setting. We start in the clavicle area and the area around the chest, both sides, in the high bicep, in the elbow, in the wrists, in the wrist area, in the elbow. Again, we come right across the upper area of the body here. Again, it's slow and methodical. Watch the points. We're just tapping gently on these points, very, very gently. We don't drive the massager into the body. Then we get a reverb relationship here. We just want to make that vibration go into the body. The way this sets up is like a fishbowl. The skin is the glass of the fishbowl. The water is our immune system, and the water, blood, liquids in our body. And the bones are the fish. So anywhere we tap gently on the body, this little fish knows exactly where we are. Okay? And then we come down the sternum area, Gently down the sternum. There's 6 points there. Okay. Go into the abdominal area around the belly button. You see, it's just a very light, gentle tapping situation here as we move down the body. We've done the wrists, we've done the chest, we've done the clavicle area, the arms. Okay. Now we're ready to move into the areas around the knees. Again, these are all approximate areas. Okay, we're looking at the transition points. These are very tendinous and ligament concentrated areas. Above the knee, at the knee, below the knee. Okay. Again, we can hit the hip area on both sides as we come down this pattern. Okay. We get into the ankle area. Here we palpate for the ankles. Come through here. As these muscles lengthen, the warmth of the towels continue to keep the ankles and these muscles lengthened. It's a very dynamic treatment. Into the little toe. We can do the base of the foot. Back up again and repeat. Again, I'd like to read the dissertation from Dr. Turchaninov's book, how important it is to treat the tender points that are found and where they're located in the transition area. Here it is. If the trigger points are usually located in the muscle bellies, tender points are mostly positioned in the place of transition of the muscle into the tendon or insertion of the muscle into the fascia or bone.
I can't begin to thank you for giving me my life back. After 3 years of battling severe fibromyalgia and myofascial syndrome with constant pain, I felt there was no hope of having a normal life again. At my lowest, I even contemplated suicide. Now my life has taken a new turn and I feel reborn. Not having to depend on the drugs to keep me going every day is truly a miracle. Getting up in the morning and being able to walk to the bathroom without a cane is something I'll never take for granted again. Hopefully more people who suffer from this condition and other chronic pain will be helped by you before the doctors pump them up with unnecessary narcotics like Oxycontin, which nearly destroyed my life. Thank you again, and God bless you.
Words cannot express how great it is to have my wife back again. When we found you on the internet and read about your no-problem attitude towards the treatment of fibromyalgia, I was obviously skeptical when you said you could do in 3 days or less what doctors have not been able to do for my wife in 3 years: take away her pain. After spending just one evening with you and seeing the amazing turnaround in my wife's condition the following morning, I truly believe in your mission against the insurance, medical, and pharmaceutical industries. Drugs, in particular Oxycontin, are the worst prescription for fibromyalgia. Taking you up on your offer to bring my wife to Chicago was the best decision I could have ever made. I have not seen the woman I am with now in 3 years. We walk, dance, exercise, go to the beach, golf, do things we have not done together in a long time, and she does it all with little pain or no pain at all. And best of all, no drugs are necessary. Thank you again.
In 2000, I was helping many people, especially around the United States and in the Chicago area. I was also flying people to Chicago to treat them. And the main thing that got this whole problem started was that I had cured the mayor of Westchester of cancer by opening up his immune system and using a high vibration oil to cure his cancer. He went back to Loyola where he was getting chemo and radiation, and they told him that they couldn't find any cancer. Well, when I found out about 3 weeks later, I decided to set up a program of cancer prevention and cancer treatment for the residents of Westchester. We formalized a letter or 2 letters for these 2 protocols. with a student of mine, and we presented them to the mayor. He got very upset that somebody would be treating or preventing cancer in Westchester, and immediately sent the zoning officer to my home where I had a treatment area. I did not have a business there. I did not need to charge anybody for my services, and it was working very, very well. So I dismissed the zoning officer, and within a short period of time, I was reported to the IDPR, which is the Illinois Department of Professional Regulation, and 2 officers from their offices came to my clinic to see what I was doing with fibromyalgia. One of the officers claimed to have fibromyalgia and wanted my treatment, and claimed that she was on a whole bunch of drugs. During the time I was treating her, her associate went upstairs to use the bathroom and snooped around in my medicine chest. Subsequently, I found out that he had described many colored bottles in my medicine chest, like oil of Olay and Tiger Balm. I didn't even have aspirins at that point in time in my medicine chest. They dismissed themselves, thanked me for my cooperation, didn't tell me that they were with the IDPR, and went promptly to the Westchester Police and gave them a report as to what had happened. Not too long after that, I was issued a cease and desist order, and